So what's the best posture you should sleep in if you're suffering back pain or even neck pain? So often sleeping can be quite a painful experience for people. You wake up stiff, you wake up in discomfort, you can't get to sleep because you're in pain or you're always tossing and turning. Today I just want to discuss kind of the best postures to sleep in to help ease any discomfort and allow you to wake up without that kind of discomfort and the stiffness. So with regards to your lower back pain, I would avoid sleeping on your front. The reason we say this is because when you lie on your front, you tend to hyperextend your lower back. So you arch your lower back, which compresses all the joints in your lower back, which when you wake up in the morning, you're going to feel a little bit stiff and your likelihood you're going to feel a little bit discomfort. This might not happen straight away, but over time, you'll probably find sleeping in this posture can really aggravate your lower back. The one way you can sleep on your front is placing a pillow underneath your pelvis. So you lie on top of a pillow, so it flattens out your back a little bit and it'll take a lot of pressure on your lower back. But being wary that actually sleeping on your front, where you put your head. So you're going to have to turn your head to one side, and oftentimes you can find this actually aggravates the neck. So we'll talk about that a little bit more a little bit further on. So going back to the lower back, if you are going to sleep on your front, make sure you sleep on a pillow to help back down to your back so you're not overloading your lower back. Alternatively, sleep on your side. Okay, so when you sleep on your side, I always recommend putting a pillow between your knees to try and keep that your pelvic position so you're not rotating through the pelvis, and this will avoid aggravation of the lower back because you're not twisting it for long periods of time throughout the night. Now, a lot of people sleep in kind of like a recovery position, so you have your bottom leg straight and the top leg you just like wrap it around, and actually this causes a lot of rotation in the lower back and can actually aggravate it. So the best way, both knees bent, not all the way up into your chest, just comfortable, but place a pillow between your knees and you'll find that actually you wake up a lot more comfortable. The other way then is also sleeping on your back, but again, oftentimes you'll find if your legs are straight, you'll find that because we tend to sit for long periods throughout the day, we have tight hip flexors. As we straighten our legs, it'll pull us into this kind of arch position, which will overload the lower back during the night. So another way you can avoid that is placing some pillows, just one or two under your knees to cause a slight bend in the knees, and this will take the pressure for your lower back. So again, just to recap, if you're suffering with lower back pain and it's affecting obviously your sleep, or you're waking up stiff and in discomfort, three positions you can sleep in: one on your front but with a pillow underneath your pelvis, on your side with both legs bent stacked on top of each other with a pillow between your knees, and the third way is on your back but with one or two pillows placed underneath your knees to take the pressure off the lower back. Another way then, obviously if you're suffering with neck pain, if you're sleeping on your front, you're going to have to sleep on your side and you go into a bit of extension. So you're going to be stretching one side of your neck and compressing the other, which over time is going to lead to obviously pain and stiffness. So I would avoid sleeping on your front. So again, the best way is sleeping on your side or on your back, but you've got to make sure the pillow fills the space between your shoulder and your neck. So you're not sleeping too much one way, so you're compressing all the joints in your neck, or too much the other way where you're stretching the soft tissue for extended periods of time. And again, that space there should be the same when you're sleeping on your back. So you shouldn't be extended forward or backwards. It should be a nice neutral spinal position.